Assalamualaikum warahmatullahi wabarakatuh. My name is Junaid Pinto Adta and I'm going to discuss the acquired immunodeficiency syndrome or AIDS. So first, what is the difference between AIDS and HIV? So AIDS is a condition while HIV is a virus that may cause an infection. Contracting HIV can lead to the development of AIDS. AIDS or stage 3 HIV develops when HIV causes serious damage to our immune system. Acquired immunodeficiency syndrome or AIDS is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus or the HIV. By damaging our immune system, HIV interferes with our body's ability to fight infection and disease. So the HIV is a sexually transmitted infection or the STI. It can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens our immune system to the point that we will have an AIDS. A person is said to have AIDS when their immune system is too weak or to fight off infection, and they develop certain symptoms and illnesses. This is the last stage of HIV when the infection is very advanced and if left untreated will lead to death. HIV is a virus that attacks cells in the immune system, the body's natural defense against illness. The virus destroys a type of white blood cell in the immune system called a T helper cell, also referred to as the CD4 cell, and uses these cells to make copies of itself. As HIV destroys more CD4 cells and make more copies of itself, it gradually weakens a person's immune system. This means that someone who has HIV and isn't taking treatment for it will find it harder and harder to fight off infections and diseases. If HIV is left untreated, it may take up to 10 or 15 years for the immune system to be severely damaged that it can no longer defend itself. However, the rate at which HIV progresses varies depending on age, general health, and background. There is no cure for HIV or AIDS, but medication can dramatically slow the progression of the disease. These drugs have reduced AIDS death in many developed nations. Pathogens or causative agents of acquired immunodeficiency syndrome or AIDS. The causative agent of AIDS is the human immunodeficiency virus or the HIV. The HIV is a retrovirus. There are two most common strains of HIV. The first one is the HIV-1, which is distributed worldwide. The second one is the HIV-2, mainly endemic in West Africa. The next one is the patient care. There is no vaccine to prevent HIV infection and no cure for AIDS, but you can protect yourselves and others from infections. The following are the tips to help preventing the spread of HIV. First, use treatment as prevention or the TASP. If you're living with HIV, taking HIV medication can keep your partner from becoming infected with the virus. Next, use post-exposure prophylaxis if you've been exposed to HIV. The next one is use a new condom every time you have sex. Next, consider pre-exposure prophylaxis or the PrEP. The combination drugs of emtricitabine plus tenofovir and emtricitabine plus tenofovir alafenamide can reduce the risk of sexually transmitted HIV infection in people at very high risk. The next one is tell your sexual partners if you have HIV. It's important to tell all your current and past sexual partners that you are HIV positive. They'll need to be tested. Next, use a clean needle. If you use a needle to inject drugs, make sure it's sterile and don't share it. The next one is if you are pregnant, get medical care right away. If you are HIV positive, you may pass the infection to your baby. But if you receive treatment during pregnancy, you can significantly cut your baby's risk. And last one is consider male circumcision. There's evidence that male circumcision can help reduce the risk of getting HIV infection. Reservations and mode of transmission. HIV is transmitted through bodily fluids that include blood, semen, vaginal and rectal fluids, and breast milk. Some of the ways HIV is transmitted from person to person include: first, through vaginal or anal sex, the most common route of transmission. The next one is by sharing needles, syringes, and other items for injection drug use. The next one is by sharing tattoo equipment without sterilizing it between uses. The next one is during pregnancy, labor, or delivery from a pregnant person to their baby, and also during breastfeeding. Next one is through premastication or chewing a baby's food before feeding it to them. And lastly, through exposure to the blood, semen, vaginal and rectal fluids, and breast milk of someone living with HIV, such as through a needle stick. We should always remember that HIV does not transfer through skin-to-skin contact, hugging, shaking hands or kissing, air or water, sharing foods or drinks, saliva, tears, or sweat, unless mixed with the blood of a person with HIV, sharing a toilet, towels, or bedding, and lastly, mosquitoes or other insects. The following are the symptoms of HIV. In early stage, a person with an HIV will feel fever, chills, joint pains, muscle aches, sore throat, sweating at night, enlarged glands, red rash, tiredness, weakness, and intentional weight loss thrush. In late stage, a person with an HIV will feel or have a blurred vision, diarrhea, dry cough, fever lasting for weeks, night sweats, permanent tiredness, shortness of breathing, and white spots on tongue or mouth. Laboratory diagnosis. We can use blood test, antibody and antigen test, and the nucleic acid test or NAT.